Welcome to the Pediatric Nephrology series on metabolic acidosis. This presentation, led by Dr. Ahmed S.A. Solomon, will cover diagnostic and therapeutic approaches. Dr. Solomon is affiliated with El Hadda Armed Forces Hospital in Saudi Arabia and Benha University in Egypt. The concept of pH, or potens hydrogen, was introduced by S.B.L. Svensson. Understanding pH is crucial in assessing metabolic acidosis, as it measures the acidity or alkalinity of a solution, impacting various physiological processes. A historical review highlights key contributions to acid-base balance understanding. Lawrence J. Henderson and K. Hasselbalch made significant strides in the early 20th century, laying the groundwork for modern interpretations of metabolic acidosis. The objectives of this session are to understand the basics of acid-base balance and to identify metabolic acidosis using diagnostic and therapeutic approaches. This foundational knowledge is essential for effective patient management. Part 1 focuses on the basics of metabolic acidosis. We will explore the fundamental concepts necessary to understand this condition, setting the stage for more detailed discussions on diagnosis and treatment. Maintaining pH balance is vital for physiological functions. The body regulates pH through exhaling CO2 and renal processes like hydrogen excretion and bicarbonate generation. A pH range of 7.35 to 7.45 is crucial for homeostasis. The anion gap is a key diagnostic tool in metabolic acidosis. It helps differentiate between wide and narrow anion gaps, indicating various underlying conditions. Understanding this concept aids in accurate diagnosis and treatment planning. The bicarbonate buffer system is essential in maintaining acid-base balance. It involves the conversion of CO2 in water into bicarbonate and hydrogen ions, stabilizing pH levels. This system is crucial in managing metabolic acidosis. Identification of metabolic acidosis involves analyzing total CO2 levels and pH. Differentiating between acute and chronic conditions is vital. Normal CO2 levels vary by age, with specific ranges for neonates, infants, and children. Metabolic acidosis can be classified by anion gap. High anion gap indicates acid addition, while normal anion gap suggests bicarbonate loss. Understanding these classifications helps identify underlying causes and guide treatment. Clinical effects of metabolic acidosis vary. Acute cases may cause tachypnea and arrhythmias, while chronic conditions can lead to growth retardation and nephrocalcinosis. Recognizing these effects is crucial for timely intervention. Part 2 covers the diagnostic approach to metabolic acidosis. The aim is to identify primary metabolic acidosis, assess severity, uncover underlying causes, and detect mixed lesions. This structured approach ensures comprehensive evaluation. The diagnostic approach involves clinical evaluation, history taking, and laboratory workup. Key factors include serum anion gap, electrolyte levels, and potential causes like sepsis or trauma. This thorough assessment guides effective management. Confirming metabolic acidosis requires blood gas analysis. Calculating the anion gap helps differentiate between primary and mixed conditions. This step is crucial for accurate diagnosis and appropriate treatment planning. Formulas are essential in diagnosing metabolic acidosis. Calculating serum and urine anion gaps, corrected anion gap, and delta gap ratio provides insights into the condition's nature. These calculations are vital for precise diagnosis. Part 3 focuses on the therapeutic approach. Treatment depends on whether the condition is acute or chronic. Addressing the underlying cause, administering sodium bicarbonate, and monitoring electrolytes are key principles. Acute metabolic acidosis requires immediate intervention. Checking for underlying causes like sepsis or DKA is crucial. 4-bicarbonate may be administered with careful monitoring of serum levels and potential interactions. Chronic metabolic acidosis management involves oral alkali therapy. Sodium bicarbonate or citrate is used, with doses tailored to individual needs. Monitoring serum CO2, sodium, potassium, and calcium ensures effective treatment.